This webinar series is both a celebration and a learning opportunity. As we move through today's session, we aim to recognize effective leadership, advocacy, and community engagement strategies to strengthen health programs and services. Understand the importance of grassroots involvement in family planning and adolescent youth sexual reproductive health awareness and service delivery. Enhance adolescent friendly services through inclusive program design, coordinated referrals, and multisectoral partnerships. A big welcome to all the health professionals joining us from the field. We are grateful for your presence and continued commitment. PRC CPD units are accredited for today's webinar. We have one unit for medicine, three for nursing, and one for midwifery. Before we dive into today's session, we would like to share this video overview of what the Challenge Initiative or TCI is, especially for those who may be hearing about it for the first time.
Did you know a single investment has the power to tackle a multitude of global challenges? Urban poverty, maternal and child deaths, climate change, gender equity, and human rights. This investment is family planning. Evidence shows that for every dollar invested in family planning, society reaps $120 in benefits. Where can we invest to have the greatest impact? In the rapidly growing urban slums of Asia and Africa. 70% of the world is expected to live in cities by 2050. 90% of this growth will be in Asian and African urban areas. And most of that growth will be in poor urban slums. Providing family planning to women and girls living in these slums can ensure a brighter future for all global citizens. When a woman or girl can decide whether and when to have a child, she is empowered to pursue an education, a job opportunity, or start or grow a family. This leads to many benefits: better health for children, women, and families, increased attendance and better performance in school, improved economic conditions for communities, lower healthcare costs, less stress on urban infrastructure. The Challenge Initiative offers a groundbreaking opportunity to have a dramatic impact on underserved urban poor communities. The initiative is business unusual, considering financing, scale-up, and sustainability in providing urban family planning solutions that work. It is a strategic shift away from the traditional aid model because local city governments decide if they want to participate, committing their own human and financial resources, political will, and ideas for solving family planning challenges. In return, cities get access to technical expertise and high-impact, evidence-based solutions to adapt for their local context. The initiative also provides funding through its Challenge Fund, which is open to other donor contributions, ensuring even greater returns when cities implement their own family planning programs. In addition to helping solve one of the most pressing issues of the 21st century, contributing to the Challenge Initiative provides major leverage for both cities and donors. Invest in innovative, high-impact family planning programs with trusted partners and proven solutions. Join our challenge.
Through partnerships, coaching, and capacity building with 24 city partners across the country, the Challenge Initiative Philippines is proud to contribute to the improvement of family planning outcomes, helping produce 131,466 additional clients of FP methods as of February 2025. 2,952 healthcare professionals trained on family planning competency-based training or FPCBT. 14 cities achieving a target modern contraceptive prevalence rate or MCPR of 30% or higher. We are excited to share more about TCI throughout today's session and hope you'll be inspired by the work being done across the country. Before we proceed to our featured city presentations, let us first listen to a statement of support from our partner from the Department of Health. represented by Dr. Anne Isabel Andres. Dr. Anne Isabel Gonzalez Andres is a public health physician with a decade of experience in different areas of health sector. She attained her medical degree from the Pamantasan ng Lungsod ng Maynila. Her career in public health started in 2013 serving as a doctor to the barrio in Bagak, Bataan. During this time, she also took her master's degree in public management, major in health systems and development at the Development Academy of the Philippines. She was absorbed into the local government unit where she was deployed and served as a municipal health officer for 5 years. With her passion for bringing health and wellness to the grassroots, in 2019, Dr. Andres joined the Disease Prevention and Control Bureau, Department of Health Central Office as a medical officer for, with a bigger and bolder and more ardent perspective of serving the Filipino people nationwide. Currently, she is the National Program Manager of Safe Motherhood Program and the concurrent officer in charge of the Child, Adolescent, and Maternal Health Division of the Disease Prevention and Control Bureau. Without further ado, let us welcome Dr. Anne Isabel Gonzalez Andres.
A happy and healthy day to all the participants, guests, and organizers of the Challenge Initiative Online Graduation Forum. I would like to thank the Zwilig Family Foundation and the Challenge Initiative for inviting us to observe the graduation of the cities of Manila, Las Piñas, Mandaue, Santiago, Binyan, Naga, Iloilo, and Iligan via online learning forum entitled Sustaining Momentum, Driving Leadership in Building Responsive Systems for Family Planning and Adolescent Sexual Reproductive Health. Knowing that this forum will be a platform for the cities to showcase their best practices that have resulted in significant improvements in health outcomes for adolescent pregnancy, prevention, and responsible parenthood, we would like to extend our sincere gratitude to your cities for striving hard to institutionalize and scale up our program and by being a good model of the evolution of health services. At the end of the day, we all wanted the availability of youth and adolescent-friendly services, as these services play a crucial role in ensuring young people have access to comprehensive, private, and confidential health care, as well as the information and support they need to make informed decisions and lead healthy lives. Through your initiatives, we can aim in fostering an effective and efficient platform to communicate, connect, and collaborate with the involved stakeholders in the realm of adolescent health. In order for the country to achieve the universal access to these services and thereby reduce maternal mortality, lower adolescent fertility rates, and promote sustainable human development, we need the initiatives of our LGUs, the help of our partners such as ZFF TCI, and the participation of the adolescent themselves. It is very important that we give emphasis to the large, productive, and healthy Filipino youth population. So let us join hands in identifying the needs and behavior of adolescents as we craft our national policies, implement plans, and programs such as the Comprehensive Action Plan towards the prevention of adolescent pregnancy and certification of AFHF coupled by adolescent job aids skills enhancement training. On behalf of the Disease Prevention and Control Bureau, let us work in achieving a well-informed, empowered, responsible, and healthy adolescents who are leaders in society. As we prioritize investments in our adolescents, we are not only supporting their individual well-being, but also laying the foundation for a more just, equitable, and prosperous world for generations to come. Dahil sa bagong Pilipinas, bawat buhay mahalaga. Thank you very much and good day to all of you.
Thank you, Dr. Andres, for your compelling message that frames today's crucial dialogue on improving access to family planning for vulnerable and underserved populations. We are grateful for your ongoing support and your dedication to promoting family planning and AYSRH through innovative, community focused approaches across our partner cities. Last session, we were inspired by the leadership journeys of Iligan, Naga, and Santiago. Today, our focus shifts towards equity and access to family planning services. With our sub-theme, expanding family planning services to priority populations through targeted outreach. We highlight the local efforts of the cities of Binyan, Mandaue, and Manila. These cities will showcase how targeted outreach, community engagement, and mobile service delivery are making quality reproductive health care more accessible to those who need it the most. After each city's presentation, our partners and stakeholders will share their responses, followed by a brief open forum for questions and answers. If you have any question you wish to address to one of our speakers, please type them on the button labeled Q&A at the bottom of your screen. We will then move on to one of the most exciting parts of the program, the graduation of our TCI cities and their acknowledgement as a globally self-reliant city on urban reproductive health. To wrap up, we will have a synthesis and formally close day two of the TCI webinar series. With that, let us now proceed to today's featured presentations.
This presentation comes from Binyan City. Through the leadership of Mayor Walfredo Arman Dimagina Jr., the city has adopted a combined approach to demand generation and outreach, bringing family planning services closer to underserved families and communities. With a career rooted in law, education, and grassroots governance, former Mayor and now Congressman-elect Walfredo Arman Dimagina has transformed Binyan into a model of modern, inclusive, and sustainable urban development. After graduating cum laude in political science and passing the bar at age 27, he began offering free legal services to marginalized communities, an advocacy that remains central to his governance. He began his political career in 2001, rising from councilor to vice mayor, and eventually becoming city mayor in 2016. As mayor, he launched innovative education and healthcare programs, transforming Binyan into the vegan of the South. His leadership has earned the city numerous honors, including the Seal of Good Local Governance, Gawad Kalasag, and the Galing Pook Award. Now in a new role, he shall continue his deep commitment to inclusive and compassionate leadership. Let us direct our attention to the video presentation of Congressman Walfredo Dimagina Jr.
Isang mapagpalang araw po sa inyong lahat. I am thrilled to be here today to share our inspiring journey of boosting family planning through innovative demand generation strategies. Our story highlights the impact of combining effective outreach with community engagement, and I am excited to walk you through our experiences, successes, and lessons. Let's dive into and explore how we made a difference in empowering individuals and families to make informed choices about their reproductive health. Binyan was the richest municipality in the Philippines before its cityhood in 2010 by virtue of Republic Act 9740. In 2015, the city of Binyan, an independent component city of the province of Laguna, became the lone congressional district of Binyan, the first lone district in Laguna. The city has 24 barangays. It is the smallest local government unit. Data from the Commission on Population and Development, Region 4A, indicate that Binyan City ranks among the top 20 local government units in Calabarzon with the highest number of teenage pregnancies, reporting 4,896 cases between 2016 and 2020. In response to this significant public health concern, the city government of Binyan, under my leadership, has actively sought solutions to improve the sexual and reproductive health of its adolescent population. In 2022, I initiated a partnership with the CPD Region 4 Calabarzon, DOH Region 4, and the Swilig Family Foundation in implementing the Challenge Initiative, aligned with the city's broader adolescent health and development and responsible parenthood and family planning. TCI aims to create adolescent in youth-friendly cities across the Philippines, reducing teenage pregnancies by promoting positive health-seeking behaviors and improving access to family planning and adolescent and youth sexual reproductive health services. The City Implementation Leadership Team, which I headed, crafted a program designed based on thorough gap and root cause analysis. In the City of Binyan, we focus on a business unusual approach to address the issues of teenage pregnancy and unmet family planning needs, enabled young people to realize their full potential and contribute meaningfully to the community. Furthermore, we promoted the adoption of modern family planning methods among couples to address existing service gaps, thereby fostering responsible parenthood and contributing to the city's overall progress and development. Adolescents and youth were empowered to take control of their reproductive health and make informed decisions about family planning. They were capacitated as co-owner and partners of TCI implementation through their participation in CFF's Training on Leadership or Adolescent and Youth-Friendly Cities. To expand the reach of responsible parenthood services, we implemented in Usapang Serye, including Usapang Batang Ina and Batang Ama, provided responsible parenthood and family planning sessions to workers at the Laguna Technopark and launch Kalakihang Tapat sa Responsibilidad at Obligasyong Pamilya or Katropa and Si Lolo't Si Lola Kabalikat sa Pagpaplano ng Pamilya. To expand our services to the digital age, we use ePlano Family Planning Service and booking application in partnership with Friendly Care Foundation Incorporated, and conducted family planning caravans with CPD Outreach Itinerary Team and TCI-Philippines Incorporated. These endeavors aims to address teenage pregnancies and unmet family planning needs in the city of Binyan, with the hope of decreasing teenage pregnancies and increasing the use of acceptance of modern family planning methods. Leveraging technology for family planning, Binyan's ePlano program. This initiative received recognition from the Friendly Care Foundation Incorporated and has resulted in the city of Binyan becoming leading user of the ePlano application among its 24 barangays. One of the early interventions in the city of Binyan is the tracking of teenage pregnancies and mapping healthcare facilities in 24 barangays, which have effectively reduced early pregnancies. The team worked as one in the implementation of innovative adolescent health and development strategies in schools and community. To address teenage pregnancies in the city of Binyan, we started Teenage Pregnancy Symposium in the schools and community, Youth for Youth, Teen Trails, and AHD film dissemination. In these activities, we discussed the risk in teenage pregnancy that engage the participants in active discussion for them to have responsible choices on their sexuality. Then, breaking barrier sessions with parents, capacity building for service providers and partner stakeholders, establishment of a school and community-based teenage center, Buntins and Teenzenia activity. A framework for regularly monitoring and evaluation like quarterly implementation assessment, where facilities are visited at random to assess the quality of service, and regular pause and reflect session to assess gaps in data infused with coaching and mentoring sessions were done by city leadership team to strengthen the health system. The Servicio Arman Caravan is a comprehensive program in the mobile delivery of reproductive health and social services to 24 barangays. It includes promotion and provision of modern family planning methods, responsible parenthood, and education emergency preparedness training. The program's emphasis on meaningful community engagement contribute to the development of more resilient and empowered communities. On top of that, We upgrade 21 of our barangay health station, level 1, adolescent-friendly health centers, while City Health Office 1 and City Health Office 2, adolescent-friendly health facilities, were upgraded to level 2 accreditation, staffed with peer educators and adolescent specialists that help address issues on teenage pregnancies. Peer facilitators were also trained as youth advocates in school and community. Adolescents and youth were empowered to take control of their reproductive health and make informed decisions about family planning. They were capacitated as co-owners and partners through their participation in CFF's training on leadership for adolescent and youth-friendly cities. Looking into this as a proactive city health leadership team, a memorandum of agreement was forged between LGU Binyan, Commission on Population Development for Calabarzon, and Schools Division Office of Binyan to establish 3 school-based teen centers, both in public and private secondary schools. School-based teen centers serve as safe haven and drop-in and referral centers in schools, aiming to have well-informed, empowered, healthy, safe, and responsible adolescents. Aside from school-based teen centers, a memorandum of agreement was likewise forged between the City of Binyan and the Commission on Population and Development for Calabarzon and Barangay Binyan Council, led by Barangay Chairman Joel M. Abiso, for the establishment of a community teen center which serves as safe haven and drop-in and referral center in the community for well-informed, empowered, healthy, safe, and responsible adolescents. Based on the Field Health Service and Information System of City Health Office, there is a remarkable 78.52 reduction of teenage pregnancy cases in Binyan after 3 years of implementing the Challenge Initiative with Swilig Family Foundation. From 911 total teenage pregnancy cases in 2021, it is now down to 203 cases in 2024. These interventions helped bring down the adolescent birth rate in Binyan to 19.6 per 1,000 live births in 2024 from 47.5 per 1,000 live births in 2021. Another notable result is the increased modern contraceptive prevalence rate from 71.3% in 2021 to 83.12% in 2024. Community's active participation and involvement up to the barangay level is evident in the numerous family planning and maternal, neonatal, and child health and nutrition activities conducted in 24 barangays of Binyan from 2021 to 2024. LGU Binyan is humbled by the opportunity to share its good practices during CPD's Regional Conference on Family Planning last May 21, 2024 at NEDA Region 4A Office, Calamba City. In this event, we showcased the positive result of TCI implementation in improving its adolescent and sexual reproductive health and family planning. Through strategic interagency collaboration, we optimized resource allocation and program effectiveness for adolescent and youth sexual reproductive health, responsible parenthood, and family planning. This unified approach minimized service duplication and significantly enhanced the design and impact of key interventions. The Challenge Initiative helped us look at the weaknesses in our health system and tackle health issues with co-ownership from partners built on trust and synergy. With the city leadership team being a product of the Challenge Initiative and Swilig Family Foundation, taking the helm of the City Health Office and the non-health agencies, we are confident that the local government can better confront health challenges ahead. To our partners, stakeholders, we extend our gratitude. Thank you, TCI and CFF, in partnership with CPD, DOH, and DKT Philippines Foundation, for the opportunities to showcase the effectiveness of incorporating the demand generation and FA outreach in the service provision on family planning and adolescent health and development. What have we learned so far and our plans after graduation? First, strong political will and leadership. Second, multi-sectoral collaboration. 3, community-based advocacy. 4th, data-driven decision-making, sustained public education and awareness. This will not be the end, but will mark the beginning as we continue what we have started. We will carry our vision to sustain our hard work as we present our future plans in family planning and adolescent health. This is our commitment. TCI will become a way of life in the city of Binyan, the city of life. Maraming salamat po sa inyong lahat.
Thank you, Mayor De Maguila. Binyan's combined strategy for outreach and demand generation is a strong example of how coordinated efforts can close service delivery gaps in growing urban areas. Next, we turn to Mandaue City, where mobile outreach is helping expand the reach of family planning services. Through the innovative Women's Health Caravan, Dr. Debra Maria Catulong will share how this full spectrum of healthcare has brought vital services directly to communities. Dr. Debra Maria Catulong is a licensed medical doctor and a seasoned public health professional. Serving as the City Health Officer of Mandaue City, Doc Debra is also a distinguished trainer and lecturer on critical public health concerns, which includes sexually transmitted infections, HIV and AIDS, dengue, rabies, and the fundamental principles of primary health care. Her active engagement in community-based health initiatives demonstrates her unwavering commitment to advancing equitable, preventive, and sustainable health services for the people of Mandaue City. Let us hear more from Dr. Debra Maria Catulong.
Maayong adlaw sa tanan. On this pleasant day, we extend our warmest greetings to our esteemed government leaders, dedicated healthcare professionals, valued partners from non-governmental organizations, and the community members who have graciously joined us today. It is both an honor and a privilege to speak before you at this meaningful gathering as we celebrate our milestones that are not only transformative but life-changing. The Women's Health Caravan of Mandaue City. Mandaue City, as a pilot site for the Universal Healthcare Program, has embraced the Department of Health's Omnibus Health Guidelines, adopting an integrated approach to health service delivery. The Women's Health Caravan exemplifies this shift, offering not just family planning or adolescent reproductive health services, but a full spectrum of care for women at every stage of life. It stands as a powerful example of how we can bring universal health care closer to reality, not through isolated efforts, but through systematic, inclusive, and community-grounded interventions. Launched in March 2024, the Women's Health Caravan is more than a health outreach. It is a movement. It is a bold, community-driven initiative designed to break down the barriers that women face in accessing essential healthcare services. And it is a reflection of our collective commitment to a future where every woman, regardless of her income, her address, or her age, has the right to quality, compassionate care. We began by identifying the areas with the most urgent needs, villages either with the lowest contraceptive use and the highest adolescent pregnancy rates, and these are barangays Kubakob, Kanduman, Hagubiao, Banilad, Magikay, Umapad, Tipolo, Labugon, Ibabaw, and Pagsabungan. With strong support from barangay officials, the city leadership team initiated conversations about reproductive health, backed by data and grounded in compassion. In collaboration with the local government, healthcare professionals, and dedicated NGOs, the caravan delivers a comprehensive package of services, from free medical consultations to maternal care, family planning counseling and service provision, STI HIV/AIDS screening, breast and cervical cancer screenings, pap smear, mental health, adolescent health and wellness education, since the intention was to deliver women's health services to the villages. These services are brought directly to the communities, to barangay centers, schools, workplaces, and even shopping malls, meeting women where they are and ensuring that care is accessible, approachable, and empowering. Before the Challenge Initiative, family planning services were limited, available only once a week, with just 5 health providers. Today, thanks to our partnership with the Challenge Initiative Philippines, the DOH Center for Health Development Region 7, and the Commission on Population and Development 7, we have changed the landscape of service delivery. Through family planning competency-based training, we equipped all 27 providers across our 27 health facilities to offer progestin subdermal implant services every day, right within the communities they serve, and other family planning services. That is decentralization in action. That is innovation for impact. Then, through community mobilization, health education, and coordinated logistics, we launched the Caravan, empowering women and adolescents through knowledge and providing immediate access to the services they need to live healthier, more informed lives. Every visit, every consultation, and every lecture were systematically recorded and validated, ensuring that this initiative was not only heartfelt, but also data-driven and accountable. And what a difference it has made. In just 2 years, our modern contraceptive uptake increased from 25% to 30%, allowing us for the first time to meet the national target of 30%. Meanwhile, the adolescent birth rate decreased from 35 to 29, signaling a hopeful shift for the next generation of young women. Barangay officials have not only embraced the program, they've invested in it. Budgets have been allocated. Health facilities are being redesigned to be adolescent-friendly, and communities are actively engaging with the message that reproductive health is not a luxury, it is a right. But perhaps the greatest success of the Women's Health Caravan lies not only in statistics, but in the conversations it has sparked and the beliefs it has transformed. By stepping outside of clinic walls, we've broken the silence that often surrounds reproductive health. We've challenged myths, addressed fears, and created spaces where women feel seen, heard, and supported. Clients who once hesitated now return with confidence. Young women who were uncertain now speak with clarity. Communities that were once reluctant now advocate for more frequent visits. This is what happens when healthcare is made human. When services are local, consistent, and rooted in trust, behavior change becomes possible, and lives are changed in the process. As we look ahead, let us not only celebrate this milestone, but commit ourselves to scaling its impact. Let us continue to champion community-based health services, to train more providers, to strengthen our systems, and to listen always to the voices of the women and the community we serve. The Women's Health Caravan is a shining example of what's possible when we act with purpose and unity. Let it inspire more programs, more partnerships, and more pathways to health equity, not just in Mandaue, but across the country. To all those who made this journey possible, from the visionaries who conceptualize it to the volunteers who carry it out week after week, thank you. You are not just delivering healthcare, you are delivering hope, dignity, and change. May this caravan continue to roll forward, bringing light to communities, strength to women, and health to every corner of Mandaue City. Thank you.
Thank you, Dr. Katulong. Mandaue's Women's Health Caravan is a compelling model of how mobile outreach can bring essential services directly to communities in a dignified and accessible way. Our final city for today brings us to the capital, the city of Manila. Through its Bayanihan outreach model, the city has witnessed remarkable growth in new family planning users. Representing Manila this afternoon is Dr. Evelyn Rimando of the Manila Health Department. She will guide us through their coordinated community-based health promotion efforts. Dr. Evelyn Rimando is a licensed physician who earned her medical degree from the University of Perpetual Health Binyan and holds a master's degree in public health from the Institute of Community and Family Health Incorporated. With extensive hands-on experience in both clinical practice and public health management gained through her dedicated service to the Smoky Mountain community, Dr. Rimando now leverages this expertise as head of the Family Planning Division at the Manila Health Department. In this role, she focuses on expanding reproductive health education, advocacy, and community outreach programs, working to ensure that evidence-based practices reach the communities that need them the most. Let us all welcome Dr. Evelyn Rimando.
Magandang araw po sa lahat ng aming mga partners at stakeholders sa pagtataguyod ng family planning at adolescent sexual reproductive health. Sa ngalan ng aming City Mayor, Honorable Dr. Maricela Lacuna Pangan, at aming City Health Officer, Dr. Arnold Pangan, pahintulutan po ninyo ako na may pakita ang proseso na aming pinagdaanan kasama ng The Challenge Initiative, Swirig Family Foundation, Commission on Population and Development, Department of Health, mga miyembro ng City Leadership Team at mga kapwa naming cities na magtatapos din. Kami ay natutuwa dahil napasama ang lungsod ng Maynila sa makabuluhang araw na ito ng pagtatapos ng mga lungsod. Hayaan ninyong isalaysay ko sa inyo ang malaking tulong na naidulot ng pagbabayanihan ng mga health service providers upang dumami ang mga gumagamit ng family planning. Ang lungsod ng Maynila ay mayroong 6 na distrito, 876 na barangay, 44 na health centers at 6 na LGU hospitals. Noong 2023, ang populasyon ay 1,971,574 samantalang 1,891,095 noong taong 2024. Mas maraming mga kababaihan kaysa mga kalalakihan. Ang lungsod ng Maynila ang pangalawa sa may pinakamalaking populasyon sa NCR. Hindi naman lingid sa kaalaman ng marami na almost 9 years nakabahan ng artificial family planning method sa lungsod ng Maynila. Tanging natural family planning method lamang ang pinapromote sa mga LGU facilities. Ito ay bunga ng Executive Order Number 003 na magpalit ng liderato ang lungsod ng Maynila na lipang Executive Order 003 sa bagong EO Number 030. Maaari na magbigay ng serbisyo ngunit hindi pa pondo ng LGU ang procurement ng mga FP commodities. Bunga nito, pababang naging bilang ng FP users sa buong Luzon. Makikita sa FHSIS noong 2008 na walang acceptor sa ibang modern contraceptive method maliban sa lactational amenorrhea method, ang natural na kontrasepsyon na dulot ng tamang pagpapasuso matapos manganak. Subalit hindi ito sapat na kontrasepsyon. Unang may available lamang sa bagong panganak. Pangalawa, paglagpas na ng 6 na buwan ay hindi na mapoprotektahan ng nanay. Kaya kailangan na susunod ng maayos ang mga kriteria ng LAR. Ang ganitong datos ay nanatili hanggang 2010. Zero acceptor noong 2009 hanggang 2010 na magsimula na gamitin ang contraceptive prevalence rate noong 2011 at simula sa 3.86 ang lungsod ng Maynila, pinakabababa sa buong NCR. At makikitang natural method pa din ang services na nanatili ang ganitong status hanggang 2012. Nagkaroon lamang ng pagbabago sa mga numero noong 2013 kung saan nagkaroon na ng acceptor sa ibang method at nanatili ang gantong estado ang lungsod ng Maynila hanggang 2019. Noong 2008 ay lamang ang method na ginagamit. 2011 natural epi method pa rin hanggang 2030. Doon nagkaroon na ng acceptor ang ibang method. Nag-umpisa ang pag-priority ng family planning noong 2019 kung saan nagpalit ng bagong mayor at city health officer. Nagsimula ang masipgasig na pagbibigay ng serbisyo at pag-priority sa programa. Binigyan na rin ng pondo ang mga activities at supplies para sa family planning. Ang modern contraceptive prevalence rate ay naging 6% noong 2020, ngunit bumaba ng kaunti noong 2021 dahil sa pandemya at unti-unting tumaas ng 2022 na magbukas na muli ang mga serbisyo sa mga health centers at ospital. Dahil sa mga nakarang kalakaran sa programang ito, makikita ang epekto sa adolescent birth rate. 50% noong 2020, bumaba noong 2021 dahil sa pandemya, hindi nakakakuha ng accurate na data dahil nakatutok ang buong city sa programang may kinalaman sa COVID. Nakadeploy ang lahat ng health service provider sa mga COVID vaccine facility. Nang magbalik sa normal ang lahat, nakita na mataas pa din ang adolescent pregnancy sa lungsod ng Maynila. Ito ang mga datos bago ang partnership with the Challenge Initiative. Masigasig naman ang pagbibigay ng serbisyo at tinuring na priority ang programa. Maraming kinakaharap na problema bunsod ng ilang dekadang inaccessibility ng family planning. Hindi ito madaling lutasin dahil laganap ang problema sa buong health system. May mga dilema kagaya ng limitadong pag-access sa mahalagang impormasyon ng pagpaplano ng pamilya para sa mga kababayang nasa reproductive age, mga kabataan at mga kalalakihan. Pagkiling ng mga health service provider ng mga health center sa mga natural family planning method. Hindi sapat na bilang ng mga health service provider na sinanay sa PCBT1, PSI at IUD. Kinakailangan palakasin ng mga serbisyo ng family planning at adolescent sexual reproductive health sa mga health facilities ng lungsod. Kawalan ng patakaran at kasunduan sa pagbabahagi ng datos sa mga pangunahing ahensya. Hindi priority ang family planning ng nakaraang namumuno. Nagkaroon ng assessment sa programa at nakita ang ilang mga problema. Karamihan sa health service providers ng health center ay naghihintay ng mga darating na mga kliyente ng family plan. Nakita na konti lang ang mga kliyente sa kadahilan ng nanggaling sa pandemya. Naging limitado ang serbisyo sa mga health centers. Kailangan lumabas at mag-ikot sa mga barangay para i-promote na nag-uumpisa na ulit ang mga serbisyo ng mga health centers, lalo na ang serbisyong family planning. Mula sa assessment na ito, nakabuo na idea ang mga staff na kumikira sa family planning naumpisahan ang bayanihan para mas maraming kababaihan nasa reproductive age ang maabot na sa family planning. Inuna ang malalaking depressed barangay dahil lalo lang may maraming mga anak at walang ginagamit na family planning. Ang mga napiling 10 depressed barangay ay nasasakupan ng Baseco Health Center, Patla Health Center, Pitas Health Center, Lanusa Health Center, Salucolas Health Center, Tondo Health Center, Smoky Mountain Health Center, Ensure Health Center, Esperanza Health Center, at Kendra Hill Health Center. Ang layunin nitong bayanihan ay mailapit sa mga kliyente na serbisyong family planning. Bumuo ng team para sa mga napiling depressed barangay. Ito ay binuo ng 2 hanggang 3 kumadrona, 1 tumatayong supervisor, at 2 barangay health worker o barangay nutrition scholar ng kada pangkat. Ang bawat pangkat ay sabay-sabay lumalabas araw-araw para magbahay-bahay sa mga nasabing depressed barangay. Nagmamasterly sila ng mga kababayang nasa reproductive age at adolescent na may pangangailangan ng serbisyo ng family planning. Sa kanilang pag-iikot, may dala na silang pills, condom at TNPA. Kapag sa pagbahay-bahay, may nakita silang may pangangailangan ng family planning, ito ay kanilang kinakounsel at pinaprovide na. Kapag PSI ang gusto, ito ay kanilang nire-refer sa health center na may provider. Kapag permanenteng method ang gusto, nire-refer naman sa ospital kung saan merong provider. Pagkalipas ng 3 buwan ng pagbabayanihan sa priority areas, nakita na maganda ang resulta. Nagkaroon ng positibong salubin mula sa komunidad para sa family planning. Merong mataas na pagtanggap para sa modernong pamamaraan ng family planning. Kaya pinalawak na ang pagpapatupad sa buong lungsod. Nagbuo ng kanya-kanyang pangkat ang bawat distrito para magbayanihan. Taong 2023, nagsimula na makipagtulungan ng The Challenge Initiative sa lungsod ng Maynila. Nagbuo ng city leadership team na mayroong shared vision para sa family planning at adolescent sexual reproductive health. Nakita pang pangangailangan ng mga health service providers ng training para sa family planning. Kapag pinarami ang train at pinalakas ang supply, mas magiging accessible ang mga kailangang serbisyo sa mas marami pang barangay. Mas maraming magtutulungan para mabawasan ang bigat ng trabaho. Para matupad ito, nagkaroon ng training para sa mga komadrona na FPCPT-1. Ito ay in coordination with the Department of Health bilang trainer. Pagkalipas ng 4 na buwan, nagkaroon naman ng training ng progestin subdermal implants sa 20 kumadron. Sa Amang Rodriguez Medical Center ito ginawa. Dahil dito, nagkaroon na ng implant provider ang bawat health center ng Maynila. Dahil sumunod na taon, nagkaroon naman ng training ng IUD para sa 15 health service provider at sa parehang taon nagkaroon ng training of trainers para sa implant at natagdagan pa ng 38 na health service provider na na-train sa implant. Bukod sa mga taga-health centers, meron din kasamang na-train na galing sa mga Manila LGU Hospital. Ito ay kinandak ng Pabelia. Mga current users ng particular na mga significant events. Pagkaraan ng 2 taon na implementasyon, nakita natin ang pagtaas ng modern contraceptive method ng 4 na beses. Samantala, ang adolescent birth rate ay bumaba dahil sa 61 ay naging 15 na lamang. Dahil sa magandang partnership sa The Challenge Initiative, maraming pagbabago ang nangyari. Pinalakas ang pag-access sa mahalagang impormasyon ng family planning para sa mga kababaihang nasa reproductive age, mga kabataan, mga kalalakihan, natugunan ng provider bias sa mga health center. Nagkaroon ng mas maraming trained health service providers para sa family planning kagaya ng FPCBT1, PSI at IUD. Pinahusay ang paghahatid ng serbisyo na may kalidad sa mga health centers para sa family planning at adolescent sexual reproductive health. Pinatatag ang mga patakaran sa pagbabahagi ng datos at kasunduan. Ang mga miyembro ng City Leadership Team ay na-train para sa Health Leadership and Management Program kung saan para mas patatagin ng team ang programa para sa family planning at adolescent sexual and reproductive health. Sa aming partnership with the Challenge Initiative ay nagpapahintulot sa lungsod ng Maynila na maging matatag at maging makabago. Kami ay lubos na nagpapasalamat sa partnership na ito at tinitiyak namin sa inyo na patuloy naming isusulong at patatatagin ang programa ng family planning at adolescent sexual reproductive health kasama ang Commission on Population and Development, Department of Health, Sweden Family Foundation at mga miyembro ng City Leadership Team. Dito sa lungsod ng Maynila, kayong lahat ay aming kakalingain. Kalinga sa Maynila, pulong-pulong sa pagtulong. Maraming salamat po.
Thank you, Dr. Remando. Manila's Bayanihan outreach approach reinforces the power of community collaboration in reaching new users and building trust in public health programs.
I believe everyone has now gained valuable insights and inspiration from the change narratives of our three cities. Confronted with significant challenges, including increasing adolescent pregnancies and the COVID-19 pandemic, our mayors and their city leadership teams demonstrated excellence through collaborative problem solving and joint solution development. Well done, Binyan, Mandaue, and Manila. We enjoin our attendees who want to learn more or have questions to please post your questions on the Q&A button seen at the bottom of your screen. We will provide the learning materials for all our city's case stories following the webinar. For further information, please visit our TCI University website, tciurbanhealth.org, for more information. A post-webinar toolkit will also be sent within 1 month from our webinar's conclusion. We now invite our partners from the Commission on Population and Development, or CPD, to share their impressions for today's presentations. We have two regional directors from Region 4, starting with the Regional Director for Calabarzon, Ms. Marilyn Ogaya. Ms. Marilyn Ogaya is the current Regional Director of the Commission on Population and Development, Calabarzon, with 29 years of dedicated public service in both national and regional offices of CPD. Her extensive career spans technical and administrative roles, contributing significantly to the advancement of population and development initiatives. She holds a Master's of Arts in Demography from the UPPI and a bachelor's degree in business education from PUP Manila. She is also a licensed teacher. Director Ogaya is recognized for her expertise in demography, gender, responsible parenthood and family planning, and adolescent health development. Her leadership continues to drive impactful, evidence-based programs in Calabarzon, aligning with the country's population and development goals. Let us all welcome R.D. Marilyn Ogaya.
Masayang pamilya! It's a great privilege to share my reflections on the powerful and inspiring presentations of our three graduating cities, Binyan, Mandaue, and Manila, each of which has clearly demonstrated what it means to expanding family planning services to priority populations through targeted outreach. Let me begin with pride and gratitude with Binyan City. As the Regional Director of CPD Calabarzon, I could not be prouder. Seeing Mayor Arman Dimagila Jr. himself lead today's presentation sends a strong message, not just to the city, but to all of us, that adolescent reproductive health is a shared priority from the highest levels of leadership to our barangays. Binyan boldly owned the issue of adolescent pregnancy And from there, they took action, not just through services, but also through strategic interagency collaboration and a unified community response. The embrace of TCI and partnerships with other stakeholders reflect their commitment to empowering young people to take charge of their lives and their health. This is not more than a public health win, but it's all a whole of community victory. Turning to Mandaue City, we witness how the integration of health services can be life-changing, especially for women. Mandaue's Women's Health Caravan can be more than a service delivery platform. It's a safe space where women are seen, heard, and cared for at every life stage. But what stood out was the recognition that family planning does not exist in isolation. By addressing the broader spectrum of women's health from adolescent to motherhood and beyond. Mandaue shows us that we must need women not just where they are, but as who they are, in the fullness of their needs and realities. Mandaue City truly sets a model that others can follow. And finally, we journeyed with City of Manila through a powerful 25 years transformation from a time when modern family planning was restricted to the birth of the Bayanihan program, a community-based strategy for both demand generation and service delivery. The city's commitment to turn its past into a platform for change is both humbling and inspiring. Manila's Bayanihan is not just a program, it is a movement rooted in collective spirit, inclusivity, and access. By bringing services directly to communities and mobilizing people power, Manila reclaimed the role as a champion of family planning and public health. From these three cities, we see the targeted outreach is not simply about logistics or caravans. It is about listening, responding, and reaching out with intention. It's about putting people at the center of every program and plan. Whether it's the youth of Binyan, the women of Mandaue, or communities of Manila, each initiative we saw today is a reflection of deep commitment, bold leadership, and community partnership. In closing, allow me to congratulate all three cities for not only graduating from the program, but for seeing a high standard of what people-centered family planning outreach can and should look like. May your stories continue to inspire more local governments to take the bold, inclusive, and compassionate steps towards achieving our shared vision. A future where every individual and every family has the information, the services, and support they need to thrive. Maraming salamat po.
Thank you, RD Marilyn, for your insightful presentation on Popcom's meaningful partnership with TCI. Your emphasis on collaborative efforts to strengthen adolescent and reproductive health programs underscores how strategic alliances can create safe, informed, and supportive spaces for our young people. With that, let us now turn to the other side of Southern Luzon, the Mimaropa region. We are pleased to welcome Mr. Reynaldo Wong. Mr. Reynaldo Wong has built a distinguished career in CPD, where he has consistently championed adolescent health, family planning, and poverty reduction through population management strategies. After years of dedicated service in CPD Region 9, he was appointed as the first full-fledged regional director of CPD Mimaropa. Under his leadership, the regional office has prioritized addressing adolescent pregnancy and promoting family planning as a key intervention to combat poverty, malnutrition, and disease. His strategic vision has been instrumental in positioning CPD Mimaropa as a proactive force in population and development work across the region. Director Wong continues to lead CPD Mimaropa in forging partnerships with local government units and stakeholders to deliver results driven, people centered programs that support national demographic goals. RD Wong, we are excited to hear from you today.
Magandang magandang umaga sa inyong lahat. Binabati ko ang munisipalidad ng Maynila, Mandaue at Binyan. Ang mga syudad na ito ang siyang nangunguna or at the forefront of fighting or eliminating adolescent pregnancy and promoting responsible parenthood and family planning in this part of the globe. Iisahin ko na lang po ang pag-iisahin ko na lang po ang aking reaction para sa tatlong LGUs. As development workers, we are ensnared with stories that are unbelievably still happening in this day and age of the fourth industrial revolution. Reports of maternal and infant deaths, extreme poverty, early sexual transactions resulting in unintended pregnancies and irresponsible parenting issues to which we all can relate. These scenarios have made us realize the importance of coordinative, consultative, and celebrative gatherings such as this one. On the one hand, most of the LGU's key people we have encountered were willing to address their local issues, but many are still ill-informed about their responsibilities. On the other hand, those who harbor some familiarity with government programs and policies we provide were ill-equipped to make these instruments work for their constituents. The greatest challenge we all face in our regions has to do with making local leaders and gatekeepers realize their efforts toward people-centered and community development. They are inseparable. How can there be any community development when the very basic societal foundation, which is the family, is without the means for self-support? I am convinced that in this context, we are all called upon to think strategically, act politically, and mobilize collectively to convince the uncommitted and rally those who are still unconvinced that the issues we have identified pose a real and present danger. While we have opened up the floodgates of support for the cause of the poorest of the poor, there is a need to make local chief executives understand the long and short-term effects of indifference and ambivalence, in contrast to taking proactive action and connecting families and individuals to service providers. Now more than ever, we are called upon to remain true to our commitment to capacitate, empower, and nurture mutual trust with local government units and their instrumentalities. Indeed, there is no substitute to real talk about concerns and responses you have identified in relaying the sense of urgency to improve the living conditions of adolescents and families. We are confident that LGUs such as yours can build bridges by closing ranks with like-minded agencies and institutions such as the TCI and CPD. The reward for what we are accomplishing will not come from monetary returns, but from the affirmation that capacity development is non-negotiable, that families need to be empowered, that the youth can be transformed, and that our desired realities are attainable if we all persevere in collaborating with empathy and taking action collectively. Thank you, TCI Philippines, for trusting the local government units of Binyan, Mandaue, and Manila, for listening to the conversations with your heart, and for forging stronger interagency relationships rooted in our shared vision of matatag, maginhawa at panatag na buhay para sa pamilyang Pilipino. The demand satisfied for modern family planning remains unstable, and this concern becomes even more expanded among the poor and disadvantaged families where literacy rate is low, employment is wanting, incidence of hunger is disturbing, and poverty incidence is left unaddressed. Because of these factors, the lack of basic information to make correct decisions in raising a family and achieving the desired family size within the context of responsible and planned parenthood is in peril. Thankfully though, TCI Philippines has helped so many LGUs reverse these concerns and the dire consequences related to unmet need for family planning by mobilizing community-based reproductive health and family planning workers to increase the chances of correct and consistent use of family planning methods and forge mutual respect between population and health workers in their respective communities. The core strategy for implementing the RPFP and AHD programs of the government has been the conduct of family development and youth development sessions in barangays and households. By partnering with civil society organizations and harnessing the power of online technology. CPD, for one, reaches out to as many target couples and individuals by providing information and motivation on the effective use of family planning methods. CPD also continues to capacitate its partners in the LGUs to push localization strategies further. And the pursuit of population and development integration advocates the conscious effort of assimilating population variables in development strategies at the local level. This means catapulting the welfare of the people in plans and programs and in the formulation of policies intended to deliver the development gains to where they matter most, the grassroots. The CPD also take the lead in informing teens about responsible sexual behavior. Young girls and boys, you have given them information about the risks of early marriage and pregnancy and the significance of self-protection. This pursuit of scientific and gender-sensitive, comprehensive sexuality education in schools and communities, exemplified by the three cities, is fully supportive of community-based awareness efforts to enable the young mature and unfold their potential and become well-rounded citizens. Salamat po.
Thank you, RD Marilyn and RD Ray Wong, for your reflections. Your insights have not only highlighted the broader impact of these initiatives, but also underscored the potential to serve as a scalable model for other regions to strengthen community-based approaches in family planning and reproductive health. Maraming salamat po. Before we proceed, we would like to acknowledge some of our guests attending our webinar. Ms. Gwendolyn Benedictos and Dr. Glenn Manarpaak of the Iligan City Leadership Team, Dr. Riza Esguerra, City Health Officer, and our alumnus city, San Jose City. Dr. Stuart Santos, Assistant City Health Officer of Pasig City, Ms. Jesslyn Puno, Population Officer of Isabela de Basilan. Dr. Leova de Guia, Chief of Hospital of Lumbia City Hospital in Cagayan de Oro, also one of our alumni. Dr. Dina Fajardo, Division Chief of Tagum City Health Office, Dr. Justine Hernandez of Las Piñas City Health Office, who will present during our next session this Friday, and the ZFF Chairman of the Board of Trustees, Dr. Manuel Dairi. Welcome to our webinar. Thank you all for gracing our event. At this point, we open the floor for questions and comments from our Zoom participants. If you have a question or point of reflection, please use the Q&A feature. May we invite our panelists to open their mics to respond to the questions. We have already noted some of the questions. Anyone from Binyan, Mandaue, and Manila could answer. And we also have a question from Miss Emelita Manala. Was there an experience of strong opposition from parents when you made family planning methods accessible to adolescents, and how did you address this?
Hey, naririnig kami from Manila.
Ayan. Thank you, Sheila. Okay, from
Yes.
Manila.
Nandito si Doc Rimando to answer the question.
Good morning, Doc Rimando.
Good morning.
Good morning po.
Hello. To answer the question, so far, we haven't experienced a strong opposition from parents regarding accessing the family planning method among adolescents. So what we do, we continue to educate our adolescents and parents about FP methods, especially during prenatal checkup. So I would just like to share that in our city, we have this activity in our public high school. So we call it the Responsable Ako, Wag Maging Biba, Batang Ina, Batang Ama. So we conduct interactive lecture to our grade 9 students. So we discuss about puberty, body changes, reproductive system, prevention of teenage pregnancy, wherein FP methods is part of the discussion. So another topic is prevention of STI, HIV, and mental health. So this effort is to decrease the incidence of teenage pregnancy. That's all. Thank you.
Thank you, Doc Evelyn Remando. So from what I got po, I think it lies in proper communication. So wala tayong miscommunication with everyone, with the young people, with parents. And I think at this point, ready na po to answer the first question for Binyan. Binyan, would you be willing to answer the first question po? The first question, ma'am, is what steps were taken to make the innovative strategies sustainable beyond their terms? And the second question po is if there are opposition from the parents on the family planning programs.
Experience opposition for the parents. Usually, we do it with the parents. Sasabayan na namin sila para sa counseling for the adolescent who is pregnant or together with the parent. Sabay. Para kung may question lang sila, we could answer it right away. Tapos, they could have, makakapili na tuloy sila ng kanilang family planning. We don't tell them what is specific for their age or something para sa kanila. We do the cafeteria method. The cafeteria method is that we let them choose kung ano yung gusto nila. It's either the natural family planning or the artificial family planning. Ganon. Hindi namin sinasabi sa client na you go to the pills, pwede sa'yo yung ganito, pwede yung ganito. Hindi namin tinuturo yun. We let them decide kung ano yung gusto nila together with the parent. Baka kasi pati yung parent mag-ano na rin sa atin for family planning. Dalawa na silang acceptor namin. So yung first question, ano nga yun? Sustainability. Um, partnership. Partnership with the NGOs. Kasi alam mo naman, kahit kami ay a city with its budget, siyempre iba pa rin yung partnership with the NGO. Kasi iba yun eh. Kasi they could give us other support para makaano kami na maging sustainability ang aming project. So, yun ang gawa ng mga NGOs. So, hindi lang basta kami. Ang ibig ko sabihin, ang aming project is, sabi ko nga, is us. Hindi kami lang. Ayun, ano pa ba ang ating gawa? Budget allocation, meron naman. Meron naman kaming budget, pero siyempre, hindi naman laging tama yon kasi meron din namang kulang sa budget namin. One thing is yung community health outreach na ginagawa ng each and every barangay, each and every BNS under my supervision siyempre or together with the family planning coordinator. So doon kami medyo umaangat. That's it. Wala na, tama na naman. Wala na akong masabi. Naka-live ba? Sorry. May question pa po? Kung kaya kong sagutin.
Sige, ma'am. Sige. How about yung sustainability po, ma'am? Paano po natin ina-ensure?
Kasi yung sinabi natin na future plans of our mayor, who is now a congressman, sa tingin namin, continuing support pa rin. Na isasama namin to sa aming agenda na supportahan kami sa itong endeavor na to. Kasi hindi lang naman pang ano to eh, panglahatan na rin naman. And it's about the health of the Binyanense.
Maraming salamat po. Maraming salamat po, Doc. And so from what I got po, the importance of parental involvement para po makapagbigay tayo ng informed choice to our adolescents and young people. And of course, the partnerships between families and NGOs, very important for access and effectiveness of family planning interventions, especially in underserved communities. We have a question directed to our speakers and CLT members. Can we hear from Mandaue City, Dr. Debra Katulong? Magandang umaga po, Doc Deb.
Hey, good morning. Can you hear me? I think my
Yes,
volume. Yeah, you can hear me. I'd like to contribute to the first question regarding the resistance from the parents. I think it is important that we normalize talking about family planning and adolescent reproductive health, even among the older ones and the lolos and the lolas, no? Because the more you talk about it, the more it becomes less stressful for the adolescents to open up. When we deal with, because we are using an integrated approach in the delivery of health services, we, if there are no adolescents there, we still talk about adolescent pregnancy. We still talk about the increasing cases of pregnant adolescents. And when they know about these incidents and the cases, increasing number of pregnant teenagers, the more they're open to referring their adolescents not to health centers, so they will have more information. So I think it's important that we talk about it more often, about teenage pregnancies, so that even the older generation will be more open to allowing their own adolescents to visit adolescent-friendly health facilities. I'd like also to comment on the sustainability of whatever we're doing right now. the CLT, the city leadership team, I think that's a very good start because we are involving different stakeholders in the implementation of family planning and adolescent reproductive health. Um, from being a city health office initiated activity, we involve the barangays. So that alone is really gonna improve sustainability of these different advocacies and initiatives. We started, for example, the Women's Health Caravan. This used to be a city health office initiated activity. And it took a while for us really to sell the activity to the different barangay health centers. But eventually, after like how many months, we were getting a lot of requests already, and this became barangay initiated. I think from there they've realized no the importance of improving access of the different health services, no, improving access of the women to the different health services. What is good about the Women's Health Caravan is these are integrated. We are integrating the different health services. Though this is not just about family planning or even adolescent health. We offer a lot of services. We offer HIV testing, mental health, general consultation. We are also offering even cancer prevention and detection services during this time. So the shift alone from being a city health office initiated to a barangay initiated, that shows a lot of commitment and ownership at the barangay level. And that definitely alone is one sure sign that we will be able to sustain the different initiatives that we have started with TCI. It is also important to engage even the non-health sectors, no? Like for example, we conducted a women's health caravan in a park mall in a shopping mall. And now that shopping mall has been telling us that why don't we do this again in October during the Cancer Awareness Month, or we do this more often. So really talking about it and selling the services, and them seeing the benefits and the advantages of doing women's health caravan, improving access to women, that alone is an indication already nga pwede nating ipagpatuloy itong activity na to even beyond the project period of TCI. So we're very, very thankful actually to TCI for all the technical support that you have provided us and for helping us form the city leadership team, which is responsible, no, which catapulted actually a lot of the family planning and adolescent health services for Mandawi City. Thank you.
Maraming salamat po, Doc Deb. Indeed, we need to create spaces for young people where they could freely talk about their feelings, about their experiences, devoid of shame, and they could just be honest about what's happening about their lives. And of course, the importance of sustainability in your programs, the importance of ownership, because it ensures long-term commitment and it increases the relevance of our program. So thank you very much for sharing your story. We have more questions coming. In your locality, what is the major factor of couples' reluctance to the use of modern family planning? So anyone can answer, or can we hear from Dr. Benjamin from Binyan City?
Our community, we don't consider reluctancy. Wala kaming reluctancy. Kasi most of the time, o kaya lagi, the couple usually go for para makaano sila ng family planning method. At saka we consider kasi in Laguna, right now, we're the number one in e-plano. Laging una. Oo, laging una kami sa e-plano. Coaching. Oo. Yun. So, reluctancy is not, sa amin. Hindi kami, doon, hindi factor para sa ma-decrease ang aming acceptance ng family plan.
Thank you very much. Dr. Benjamin. So, um, it's important that our clients are willing, so to avoid yung reluctance and about misconceptions and other things about reproductive health. We have more questions here. Can we hear back from Doc Deb? Ayan, meron daw pong. Before that, we have from Manila, Dr. Evelyn Remando.
Regarding the question of reluctance of couples, so though you see that we have a high contraceptive prevalence rate, so we have high acceptors, there are still couples who refuse to use the modern contraceptive methods. So because of the side effects, the possible side effects, so especially the abnormal uterine bleeding. But we still continue to provide counseling and correct information, so to correct their fears. So that's what we do to these reluctant couples. Thank you.
Thank you, Doc Evelyn. So the best way to combat our clients' misconception is proper and accurate information about family planning and reproductive health. Thank you po, Manila. We have more questions here. Can Dr. Debra Katulong from Mandawi answer? Are there any strict regulations by the government to restrict the contents from various social media platforms like YouTube, Facebook, and TikTok, which
Ako, ano?
show videos that could entice young kids to be liberal in their sexual behaviors? Uh, Meron po bang regulations na nag-restrict ng social media content?
Um, I think we're guided by regulations about social media. Ang alam ko may mga social media na mga limitations din in terms of posting yung information about this. But tayo naman na nasa public health sector, we also need to be very careful about the information that we present. It has to be friendly kasi ang sa social media, a lot of people look at it hindi lang yung mga targets natin. There are younger ones that are reading what is posted in the social media. So it has to be objective, straight to the point, factual. Kung may mga data tayo na pwede i-present, pwede naman yun. So what we usually do, meron kaming social media na FB account namin sa City Health Office. So yung mga friendly na mga messages that are directed to adolescents. So let us just be more careful lang. Knowing that there are the younger populations who may not understand, may not have the right perspective when you post these messages. But we all are aware that yung social media isang malaking medium ngayon natin sa pag-communicate kasi the younger generations are really looking into yung mga social media accounts now, and it's one way really to access this information. Meaning, I'd like to say that ang ibig ko sabihin is it has to be age appropriate na mga messages ang binibigay natin sa mga social media posting natin.
Okay, thank you po. Maraming salamat po, Doc Deb Katulong, for answering that rather challenging question po. So we really need to moderate our content because our audiences are getting younger and younger. So we need to filter what age-appropriate content for family planning and reproductive health we want to get out there. So to add lang po, Doc Deb, about your presentation on Women's Health Caravan, can you expound on the involvement of men in this Women's Health Caravan?
Label it as Women's Health Caravan, but actually yung sa field, we see a lot of men coming in also. So either they're there to accompany their wives, your spouses, or your girlfriends, pero marami pa rin sa kanila nag-a-avail ng mga services. No, we have services like the HIV testing, mental health na pwede ring pang lalaki. So, natatawa nga kami kasi it's a women's health caravan but you see men lining up. And it's good that they're around, especially when we do family planning counseling and or when we discuss results of the breast screening. We are also able to inform their partners, no, who is their number one support, no, sa kanilang mga dinadaanan ngayon sa katawan, no, so sa mga health concerns nila. So we cater to men. We cater to men actually during this women's health caravan, and they are free to access any of the services or even to ask questions about family planning. We're actually thinking because of that, when we saw a lot of men lining up, some of them even asked, "Don't you have a men's health caravan so that the concerns of the men will be responded to?" So we're thinking of having a men's caravan anytime this year. Na it's all kasi feeling nila napapabayaan daw sila eh, parang puro babae na lang. So ini-entertain pa rin namin sila during this women's health caravan. May mga lalaki kami nandoon. And one thing also, the women's health caravan kasi may yung daughter and the mother are both in the caravan, and the mother also listens to the concerns of the adolescents when they start asking about mga family planning concerns. So or even mental health concerns. So masaya siya. I mean, it's something that, like I said earlier, it's something that we should normalize, no? Make it something routine. Hindi dapat siya tinatago na topic. And now, no, you see a lot of adolescent pregnant, and you see a lot of yung may mga problema na nga naman nag-suicide na dahil sa problema sa pagbubuntis. So yung mga ganon, let's talk more about this. Let's openly discuss about this, and the more we normalize these things, the more adolescents will be able to talk more openly. It's easier for them to access adolescent-friendly health centers. I'd also like to point out that importante then, because if we have such demands already from the communities, that we also try to improve the supply part, no? We need to equip our providers, health service providers, the barangay health center, midwives, nurses, doctors, repeatedly, no? Palaging nire-refresh yung mga kaalaman nila about the family planning and how they can improve the way they deal and communicate with the clients, no? Para at least magkatugma ba, may demand generation at tayo din, we encourage we also improve the supply part para we will be able to respond to the needs of the communities. I think that's our primary concern as the primary healthcare service providers. Mas maganda yung nasa prevention side tayo kaysa yung nasa curative or mas magastos. So, yun. Thank you.
Thank you very much po, Doc Deb Katulong. I think that's one of the main advocacies din po of TCI is to promote gender equality. And so we encourage
Wala na
men
ko
to
inaw?
take part in family planning services because we want to challenge gender norms and help promote women's autonomy. So men's involvement in family planning goes beyond contraceptive views. They are there to support and um, open discussions on family planning with their partners. So thank you very much, Doc Deb Katulong. In the interest of time, that will be the last question that we can entertain at the moment. We will have to cut off from here, but our cities will still answer any questions you have in the Q&A box via chat. So these will be included in our post-webinar toolkit. We are so happy that you have so much to learn and your curiosities are manifested in the questions that we have seen today. Thank you for your active engagement. We hope this learning forum has provided a lot of learning for everyone. Please follow us on Facebook at the Challenge Initiative Philippines or email us through tci.ph@zuiligfoundation.org. Okay. And now we proceed to the formal graduation of our featured cities. We acknowledge Binyan, Mandaue, and Manila, their city mayors and their respective city leadership teams for their successful completion of the Challenge Initiative program and for demonstrating leadership and innovation in building adolescent responsive health systems. They have played significant roles in the implementation of scale up of proven high impact practices for family planning and adolescent sexual and reproductive health. First, we present the city leadership team of Binyan City. They are led by Mayor Arman Dimagila Jr. with support from the Gender and Development Office, City Population Office, City Health Office, and other departments and agencies. Binyan City has been awarded as a global self-reliant city in family planning and adolescent sexual and reproductive health. This award recognizes the city's exceptional governance and dedication to advancing innovative practices that combine education, outreach, and service delivery for family planning and adolescent health. May we ask the city leadership team to open their cameras to acknowledge this team? While waiting for the cameras to open, I would like to acknowledge the members of the Binyan City Leadership Team, Honorable Angel Alonte, Dr. Mirabel Benjamin, Jana Katrina Magloyuan, Henrietta Nacario, Ava Donna Tadoy, Mary Grace Balyeser, Suzanne Ann Barnachea, Gab Joris Alatiit, Lourdes de Magila, Attorney Nora Pangan, Hilario Panturo Jr., Charmaine Tandico, Maria Aiza Alcantara, Raquel San Pascual, Heidi Rachel Gatduga, Rachel Ann Masangkay, Mark Robert Almadi, Attorney Nian Ico, Dr. Jenalyn Mendoza, Carmencita Gentilla, Abigail D. Villamia, Rene Fernando, Jesusa Lopez, Marjo Gobres, Liena Lam. Congratulations, Binyan City. Hello. Wave to the camera. Hello po.
Hello po. Thank you po.
Thank you. Congratulations. We would also like to acknowledge the guidance of Binyan's regional partners, the Department of Health, CHD Calabarzon under Dr. Marwin Bello, and the Commission on Population and Development, Calabarzon under RD Marilyn F. Ogaña. Again, congratulations, Binyan City. Now we move to Mandaue City. Led by Mayor Glenn Persede and City Health Officer Dr. Debra Maria Catulong, Mandaue has also been awarded as a Global Self-Reliant City in family planning and adolescent sexual reproductive health. This award is in recognition of the city's leadership commitment in implementing high impact practices and interventions, notably in integrating comprehensive gender responsive services across the health system. Congratulations and thank you very much for rising up to the challenge. Hi. Hello po. Congratulations, Dr. Debra Maria Catulong, Cheryl Bernaldez, Cheryl Repique, Liza Gulbin, Dr. Christine Alev Felix, Christine Angel Macasero, Patrick Gerard Torres, Alexandra Manatad, Dr. Javaira Sabdula, Odeline Tan, Jovelyn Taire, Ashrel De Ramos, Dr. Lucila Avelida, Miriam Rehencia, Dr. Ira Franz Flores, and Angelica Aporte. Maraming salamat po and congratulations. We also acknowledge the guidance provided by the Mandawi Regional Partners. Thank you to Department of Health Central Visayas CHD under Dr. Joshua Brillantes and the Commission on Population and Development, Region 7 under Attorney Bruce Ramos. Congratulations, Mandawi City. Lastly, we present the City Leadership Team of Manila. The Manila CLT is led by Mayor Honey Lacuna and the Manila Health Department. Manila has been recognized as a global self-reliant city in family planning and adolescent sexual and reproductive health. This is for their exceptional leadership and consistent efforts in implementing impactful strategies that enhance the health and well-being of urban populations. By embracing a community-based approach grounded in the spirit of bayanihan, the city has improved access to reproductive health services, particularly for underserved populations. Team Manila, can you show your faces to be recognized? Hello. Hi. Congratulations, Dr. Arnold Pangan, Dr. Edgar Santos, Dr. Evelyn Rimando, Dr. Erlene Chaparro, Dr. Raul Ganya, Marites Garcia, Dr. Paz Genevieve Herrera, Belinda Rivera, Dr. Ida Magnolia Reyes, Maria Hilda Herrera, Maria Cristina Vasquez, Dr. Gina Pardilla, Mr. Felipe Canlas, Dr. Melanie Mateo, Hanilin Montaño Mabukit, Rowena Marpa, Marlene Mayor, Avelina Rivera, Dr. Mary Lila Ann Colon, Arlene Joy Soriano, Michael Himor, and Myrtle Macam. Congratulations, Manila. Helping Manila in this endeavor are our regional partners, the Department of Health, Metro Manila CHD under Dr. Lester Tan, and the Commission on Population and Development National Capital Region, Regional Director Jacqueline D. Robel. Again, we extend our congratulations to the city mayors and their respective leadership teams. Thank you very much. To Binyan, Mandaue, and Manila, may the initiatives you have started continue to serve our women and adolescents.
Thank you.
Okay, so that concludes our graduation ceremony. As part of our monitoring, again, we invite all attendees to take a moment to fill out the post-session feedback form. Your feedback not only helps us improve future sessions, but is also a key requirement for CPE accreditation. And now, to formally close our second day session, we are honored to hear from the chairman of the Zwilig Family Foundation, Dr. Manuel M. Dairi. Dr. Dairit, or Doc Manolet to us in the organization, is the former secretary of the Department of Health and current chairman of the Board of Trustees of the Zwilig Family Foundation. With decades upon decades of experience in health system strengthening and policy reform, he brings a unique perspective on how local innovations contribute to national and global health goals. Let us now welcome Dr. Manuel M. Dairit for his closing remarks.
Thank you very much, Laika, and greetings to all of the participants. As we conclude today's session, I'd like to express my gratitude to all those who presented from Binyang, Mandaue, and Manila. And of course, for everyone who participated, asked questions, and thought about the issues. As I was listening to the presentations, for despite the local context of these three cities, I think I'd like just to highlight in my closing remarks, four, you might say, common denominators amongst all of these cities. It won't be a complete presentation, but let me just mention them. I think the first one is local government leadership, even if that local government leadership shifts because of elections. And that local government leadership would include, of course, not only the mayor's office or, for example, the governor's office, but certainly the leadership at the city health office. So I think that's one of the non-negotiables, that you must have that local leadership. The second one I would say technical excellence, and technical excellence in a lot of different areas. For example, technical excellence in service delivery. And therefore, the people that deliver the services must be very well trained, they must be compassionate, they must really be wanting to help people. That service delivery would include logistics, supplies, everything that you need. And of course, eventually the documentation of the service delivery. So data quality is very, very important, because unless you have accurate, complete data, it's very hard to make an assessment of what you've accomplished. The third point would be, I would say, resources. And among those resources would include, of course, the budgets. And therefore, the role of TCI in enhancing these budgets, and also the FF, is very important. But also among those resources would be technical support, the type of information that's needed to buttress current knowledge. And in line with that, all of the partnerships that are needed to help provide both logistics and technical support. And then, of course, finally, community engagement and communications. And you can see it, at all levels, from the barangay level, the private sector, the malls, teenage centers. And therefore, when you think about the community engagement, it's very important, as you said, the presence of a city leadership team that actually orchestrates and shepherds these activities through. So, as we can see from these presentations, there was great achievement over a relatively short period of time because of all of these four factors. And therefore, you know, the proof of all of these achievements are really there. And I hope you are all very, very satisfied and feel a sense of accomplishment of what has been accomplished. So, with all of that, I would say, thank you to all and congratulations to all. On Friday, we conclude with two more cities who are leading efforts in family planning and adolescent-friendly health services. And we invite participants to join us again on Friday. But on a final note, congratulations for this graduation. This is a new experience for me, having a remote graduation with everyone waving at the camera from their own centers and their own, you might say, offices, wherever they are. So thank you all very much and good day to everyone. Back to you, Laika.
Maraming salamat po, Dr. Dairit. So, indeed, effective family planning relies on a combination of skilled, compassionate healthcare providers, accurate data and resources, and a strong community involvement. Providers must not only be competent, but also treat clients with empathy and respect. And of course, accurate data is key to understanding the community's needs and evaluating their progress and making informed decisions. Most importantly, engaging communities in the planning and implementation process builds trust and ensures cultural relevance and promotes long-term success and sustainability. Thank you very much po again, Dr. Daly. Thank you. Thank you for your presence and engagement for today.